Time is brain. So you don't have time to struggle with that stroke alert head CT. So here's a video to help you with the CT findings in acute stroke. CT in acute stroke has two main purposes. One, to exclude intracranial hemorrhage because it's a contraindication of thrombolysis. And two, to exclude other pathologies that may mimic an acute stroke. However, you don't have to stop there. You can see other findings that can help you to diagnose a stroke. Infarct appearance depends on timing. In the first 12 hours, the most common imaging finding is, wait for it, a normal head CT. However, in some, you can see a hyperdense artery or basal ganglia obscuration. Later in the acute period is when you start to see gray-white differentiation loss and focal effacement. The hyperdense artery sign occurs because you are actually seeing the thrombus in the artery. The thrombus appears hyperdense because clot is denser than normal flowing blood. Because it's clumped together, it's denser, and CT is just a measure of density. So an artery filled with clot will be denser than arteries filled with flowing blood. Because the hyperdensity you're seeing in the artery is the actual clot, there will not be flowing blood in this region on CT angiogram. So the hyperdense artery will be the inverse of the CT angiogram. Where there is hyperdensity on non-contrast CT, there will be no density or no contrast on CT angiogram, like the negative of a photograph. The other sign in the first 12 hours is the blurred basal ganglia or lentiform nucleus. Now, usually this region is a triangle of low-density white matter, the anterior limb of the internal capsule, the posterior limb of the internal capsule, and external capsule surrounding the higher density lentiform nucleus. And in acute infarct, this triangle becomes blurred. When it infarcts, the lentiform nucleus becomes more edematous. And so it becomes lower density because of the increased water content, making it similar in density to the white matter. So instead of a clean line between the gray and white matter, they look like they are smeared together, like the white matter has just been smeared into the gray matter. The lentiform nucleus is commonly infarcted because it receives blood from the lenticulostriates arteries that come off the M1. So unless there's an occlusion more distal than the M1, the blood supply to the lentiform nucleus will be cut off and it infarcts early. So why do regions become low density when they infarct? This is because when oxygen and ATP run out, as they do in an infarct, our sodium and potassium pump starts working. Now, because of the osmotic gradient, sodium and water will rush into the cell if there's not the pump to push them out. More water in the cell means lower density. This is because water is lower density than soft tissue. In fact, for every 1% increase in water content in a tissue, there is a 2.5 ounce-filled unit decrease in density. So this brings us to our next slide. Hypodense regions of brain outside the basal ganglia. If the brain is low density, that means it has run out of ATP and swelled, which means the damage is irreversible. Low density brain is dead brain, and it's a poor prognostic sign. Another region that infarcts early is the insula. This is because the insula is actually an internal watershed in the MCA territory. It's the watershed between the lenticulostriates off of the M1 and the M2 sylvian branches. So, because it's an internal watershed, it will infarct relatively early with low blood supply. Later, you will get focal effacement. Now, normally, the brain should have lots of cell sites that look like little ice cracks and crevices along its surface. As more water accumulates in the dead cells, more swelling will occur, and these cracks and crevices become effaced by the swollen brain. So now you know the 5 main signs of acute infarct on CT. Remember, if you see these 5, soon that brain won't be alive. If you like this video, you can like it or subscribe to see more. Also, you can follow me on Twitter and Instagram at TeachPlayGrub, because what more is there to life than learning, living, and eating? Thanks so much.